Okay, good evening, everyone. We are going to go ahead and get started. Welcome to our Zoom presentation this evening. My name is Adrienne Luckenbacher, and I work for St. Clair County Community Mental Health. And we are going to be presenting this evening on the topic of disability and disconnect, strategies for coping with depression and isolation for people with a disability and those who support them. For most Zoom conferences, I like to start out with some housekeeping and general information. So I'm going to get started with that. Again, I'd like to welcome everyone. We were able to actually do this Zoom tonight with participation and some requests from Blue Water League of the Blind. So I would like to give a shout out and acknowledge Bob Furtado. He contacted St. Clair County Community Mental Health asking if we would go ahead and be a guest speaker to the group, and also said, you know what, Adrienne, it's an important topic. We would really like to also extend the invitation besides our group out to folks in the community. So we had come together and talked about a couple of options and decided that we would go ahead and broadcast this Zoom live and invite the public and also be able to videotape it so we can offer it for others who weren't able to see it tonight on our YouTube channel, on our St. Clair County Community Mental Health website. So I want to thank Bob for the opportunity to be able to talk about this. I also wanted to thank Bob because we've really been able to talk and expand our ability for Zoom. This is very exciting because this has been the first opportunity that we've been able to do closed captioning on a Zoom. So I wanted to just draw everyone's attention. If that is helpful for you, we do have closed caption at the bottom, and we'll talk a little bit more how to navigate that as well. So just a few housekeeping, generally speaking, for webinars like this, if you're not familiar with webinars, the webinar format for Zoom is you will be able to see the PowerPoint and the presenters, but you don't see each other. So you won't be able to view each other. So you don't have to worry if you're sitting there drinking your coffee and relaxing that you won't be on the screen. And what we do is we do like to be able to welcome any kind of questions, comments, or sharing. And generally how we do that is through the chat feature on Zoom. So if you were to go to your toolbar and go over to the chat feature, you're able to chat from there. Also for today, to increase accessibility, we have the Alt-Y feature, which will show our host, who is Jill, is helping navigate tonight, that the hand is raised. And then we can go ahead and ask you to unmute with an Alt-A, and then you'll be able to verbally ask any questions that you have. So again, the Alt-Y will allow you to raise your hand, and pressing Alt-A will allow you to mute or unmute your screen. And these presentations are really laid back, relaxed. We really want to be able to have an experience, welcome you to ask any questions, comments, and things. So you don't have to worry about the end of the presentation. Please feel free to ask questions or raise your hand at any time, and we'll keep our eyes and ears open for that hand being raised and get to you as soon as we can. Like I had mentioned, this is closed caption, so this is our first experience with this. I also want to give a little disclaimer that I'm hoping it will pick up my words as I talk. So if it messes up a couple of things or things come off a little bit differently, I just want to apologize in advance, but I'm very impressed on how the closed captioning works so far, especially with my voice, and I'm Italian, so I tend to talk kind of quick. It's coming out all right. Another thing too is if you are watching the closed captioning and you want to increase the font, you have the ability to do that. So on your toolbar, if you navigate that on Zoom, you're able to go over to the closed captioning, click on it and click on font and choose to increase your font so you can see it bigger if that helps accessibility for you as well too. A couple of other little things is that we are doing a PowerPoint. I know that some of you are joining us by phone, which is wonderful. And if you wanted access to the PowerPoint, that will be available through our St. Clair County Community Mental Health website, which I will have the information at the end. That is sccmh.org, and it's under events, and you can click on disability and disconnect, and then you'll be able to pull up any materials, resources, and the PowerPoint from today's presentation. In addition, At the very end, we will have a link to a Survey Monkey because we really like to hear feedback about our presentations. I had talked to Bob, and if there are other accommodations that you would like for the Survey Monkey or to be able to give feedback, he said he would be more than willing to assist anybody who needs help. So you can get a hold of Bob as well too. So with that, we're going to switch over to our content for the evening. And again, I'd like to introduce myself. As I mentioned, my name is Adrienne Luckenbacher. I've worked for St. Clair County Community Mental Health for approximately 16 years and in the mental health field for about 22. I've worked at a variety of services, worked with adults, worked with youth, groups, individual therapy, individuals with disabilities, worked within the courts. And one of my jobs right now that I really enjoy is that I'm able to do trainings. I do trainings for our staff, but I am also able to go out into the community and do trainings for our first responders, our schools and organizations. So really excited to be with you tonight. I also have a co-presenter, so I asked if Elena Gottler would present with me this evening. Elena is also a clinician at St. Clair County Community Mental Health. She's been there several years, and she has extensive history of working with adults and youth and with individuals with disabilities and their supports. Because when we talk about tonight, our training, we're really talking about everybody. So all the information that we're covering tonight really applies to anyone who is human. And there are some considerations for individuals with disabilities and certainly supports of anybody. So we're going to cover all of that and go ahead and move through our presentation. So I'm going to go ahead and start talking about depression and some things to do with that. And then Elena is going to take over and talk for a bit. And then I'm going to go ahead and conclude our presentation for the day. We are looking at around an hour or so. Again, feel free to ask questions at any time or raise your hand. If you have a comment, everything is welcome because we really want this to be interactive and worth your time attending, and we greatly appreciate that. All right, so we welcomed everybody. We went through our general information and navigation. Also, if you do utilize the chat feature, Jill went ahead and put what the alt means and how to increase the font. And she also gave the link to our website where the PowerPoint is going to be. So she'll be putting information up there as well. And again, I will pass on the information to Bob. So if it's easy for everyone to get it from him, we can provide it that way as well too. So the very first thing that I wanted to talk again about is that the information that we're covering tonight is applicable to anyone, no matter if you're an adult or a youth individual that has a disability or a diagnosis, because everyone has mental health. And I think that is so important to remind everyone. Mental health over the years has been very stigmatized. And when it comes to mental health, it's seen as something that someone has, like a disorder or a diagnosis or something physical health. And what I like to remind everybody, it doesn't matter who you are, how much money you have in your pocket, what area of the globe you live on, everyone has mental health. And I think to an extent, folks realize that. But I really believe now with COVID and the pandemic that everyone is a bit more in tune to the fact that they do have mental health. Mental health is a piece of us, just like our physical health is. So just like we have our body parts, our heart, our lungs, our legs, and all the other body parts that we may have, the same with mental health. So our physical and mental health go hand in hand and they play a part together. They also feed off of each other. So as a whole person or an individual, I'm sure many of us know at times when we're not feeling well, like when we have the flu or maybe we pull a muscle, it's affecting us physically, but a lot of times it affects our mental health as well too. When I feel not so good, I kind of get grouchy and it affects my mental health. On the flip side too, when we're experiencing any kind of mental health challenges, maybe anxious or feeling sad or depressed, it has a connection with our physical health. When you're anxious, you may have gut aches or stomach aches, get headaches. When you're feeling depressed, you may feel very tired, not a lot of energy, motivation, maybe stomach aches, constipation, some things like that. So our mental health and physical health play off of each other. And I want to be able to talk about that and normalize it because there's some takeaway points that I always like to highlight when I say these are takeaway points. We're going to talk about so many things tonight. But if there's a couple of things that you take away, just realizing that everyone has mental health and it's healthy and it's okay and it's part of us being humans. Tonight specifically, we're going to talk about depression and isolation, and that is something that is deeply affecting a lot of individuals. Depression is a mental health challenge that affects many, many people. Mental health overall affects individuals, and pre-COVID, when COVID wasn't around or when COVID didn't exist, on average, 1 out of 5 adults in the United States have a mental health challenge within a given year, to the fact where it may be diagnosable. So mental health, again, is very common for folks. And we're going to talk about how the pandemic has actually increased and played a role in increasing it as well. So we're going to talk particularly about depression. So depression is more than sadness. Depression is more than feeling blue. Depression is really that deeper sadness, that deeper feeling blue, and it affects someone in many different ways in all aspects of their life. Depression really impacts the way that folks think, the way that folks behave, and also our emotions. So it has that deeper kind of impact on aspects of life. Depression, as well as other mental health diagnoses, if we're going to talk about anxiety or maybe even childhood diagnoses and different things. We talk about 2 different terms. We talk about mental health challenges, and then we talk about mental health diagnoses. And I wanted to talk about that a little bit with depression. So folks can experience depression. It's very natural and normal for folks to be sad, blue, or for it to increase to the level of feeling depressed. That would be called a mental health challenge. So mental health challenges we all face as adults. It's part of being human. It's part of being a child as well too. It's part of being, our existence is that we have mental health challenges. So that may be with depression. That may be with sadness. That may be with a variety of things. With mental health challenges, we face them, but we're able to sort of move past them, and they don't necessarily stick. For someone to have a mental health diagnosis, like a depression diagnosis, look at it like a physical health diagnosis. Someone may have blood sugar that's off a bit, but not have a diabetes diagnosis. Same with mental health. Someone may be sad or blue or depressed, but not have a diagnosis. In order to have a diagnosis of depression or anxiety or things like that, it is not unlike having a physical health diagnosis. You go to a physician or someone who can diagnose, and they take a look at your signs and your symptoms and the things that you're going through. And if you meet a particular criteria, then you get a depression diagnosis. So for today's conversation, I wanted to just talk a little bit about the difference between the two. We're going to talk about when those warning signs go up from just being sad or blue, and when it starts increasing maybe to a concern that there may be a diagnosis or need more additional support. But as far as depression is, it can impact all aspects of our life. It can impact our relationships with others. And that doesn't just mean our spouses or our love or intimate relationships. This may mean our relationships with our children, our neighbors, our social relationships. If you generally go in a bowling league, or if you're in a craft club, or if you like to play a sport, that can affect that relationship as well too. As well as our work relationships, depression can certainly impact that. Depression can also impact the way that we think, what goes on in our head, the way that we organize our thoughts, how good our focus is, maybe struggling with concentration. And then depression definitely impacts our mood and our emotions, where we may feel very sad, hopeless, lonely, depressed. So it definitely has an impact in our life. Folks can experience depression on very different levels. Someone could have a mild level of depression where the sadness is impacting them, but they're still able to carry through with those day-to-day life activities, getting up, showering, going to work, socializing, completing their hygiene, eating, taking care of kids, feeding animals. Then there may be moderate, where someone starts experiencing more significant depression symptoms, where they're still able to participate in day-to-day life, but maybe it's being impacted, where they're not going out and maybe seeing their friends or calling and reaching out as much as they did before. Maybe their sleep patterns, instead of a regular 8 hours of a night, they're finding themselves napping a lot during the day because they're feeling depressed or want to withdraw. Maybe they're finding themselves having crying spells or different things throughout the day. And then depression can also go into more severe. And what severe looks like is significant impact on those day-to-day life activities. Maybe someone isn't choosing to go to work or school. They're not socializing with people that they generally socialize. Maybe not answering their phones, possibly having thoughts of not wanting to be around anymore, or why is life worth it, or feeling hopeless. So we're going to go through some of those when we talk about some of the indicators and signs and warning signs of depression. We talked about the fact that physical and emotional pain brought on by depression can affect a person's work, relationships, and including their physical health and interests. Remember, we talked about physical health and mental health have a direct link to each other. So it's very, very common that if someone is experiencing depression, they're having more aches and pains. They're having maybe gastrointestinal issues, maybe more headaches. So it affects physical health, certainly. The impact of the pandemic has also come in. So depression has always been around. Depression has always been a topic of discussion. It's always been on the mental health grid. But we are definitely seeing as a society and mental health professionals an increase in depression with both adults and kids due to the pandemic. The pandemic, when we look at it, is really a traumatizing event for us as a culture, and it's impacted us in so many ways. And when it does, as a culture, we are starting to sort of feel those, I guess the best way to say is like if you experience like an earthquake, you get those aftershock afterwards. And with the impact of the pandemic, it has affected so many different people in so many different ways, with not being able to maybe contact or see or outreach or have that physical contact with folks, not being able to be as maybe independent as someone has been in the past. For folks, when we talk about with disabilities and visually impaired, with a lot of things like the maps and the layouts of familiar places that you may attend, like doctor's offices, stores, things like that, maybe physically very different than it was before because of the way that things are laid out because of the pandemic. Also, the impact of the pandemic has affected people because honestly, we don't know exactly when this will end or have an end to it. So this is an ongoing stressor that's impacting us, and it is affecting our depression and our moods with adults and children. And we'll talk about that a bit more. Depression is very serious and very important. And if it's left untreated, depression can get more severe. So someone who experiences mild symptoms, if they aren't able to utilize skills or maybe get that outreach and support, which we'll talk about in this training, it can become very serious. It can move into that moderate, it can move into severe, and it also can become life-threatening. So depression can be easily missed as well too. Pre-pandemic, we talk about this a lot, is that depression a lot of times gets masked with other things. First of all, when people go to their primary care physicians, which Elena is going to talk about the importance of getting a physical checkup, 67% of people that go to their primary care doctors when they are feeling emotionally challenged will not even explain that to the doctor. They will start out with their physical symptoms. They will say, I've had stomach aches, I've had headaches, I've felt constipated, but they won't necessarily say, I've felt depressed, I'm feeling anxious, I'm feeling very hopeless. So depression can easily be missed because of stigma. A lot of times, individuals don't feel as comfortable talking about their mental health challenges as they do their physical health challenges. In addition, depression can be easily missed by folks. If you have a loved one that isn't coming out, or maybe not. I had an example once where I worked with a husband and a wife, and the wife said, I did not realize my husband was depressed. I thought he was just being lazy. He wasn't keeping up on his hobby. He loved his fish tanks. They were getting dirty. The lawn wasn't being cut. And not knowing and not having that awareness or that eyes and ears open as a wife, it was easily missed as being lazy. So a lot of times depression sort of is seen as other things and can be easily missed. When we talk about individuals with disabilities, especially in, intellectual and cognitive disabilities, and for individuals that may be nonverbal or have a hard time communicating verbally, that's another way that depression can certainly be easily missed. Because if someone isn't able to say, I'm feeling sad, or express themselves to others, that can be missed. In addition to when Individuals with disabilities may have caretakers or supports that come and go or that change often. Depression can be very easily missed because the caregiver or the support that has worked with that person changes. So someone may not know, is this how Jimmy or Johnny normally is? Is this their general presentation? And may not be able to pick up on those things because of not knowing them very well historically. That's one of the reasons that it's very important, and Elena is going to talk about supports to contact each other and be on the same page and be able to red flag or tell people, you know what, I noticed when I went over to Johnny's the other day that he's not coming out of his room so much, and being able as supports to be able to do that. And with other folks, as family or friends or other people, if you notice that something's going on, I might say to another coworker, or I might talk to Elena's husband and say, you know what, I've noticed that, and let him know what I've noticed. So being able to keep our eyes and ears open with ourselves and with other people is very, very important. So depression, what causes it? That's a question that a lot of folks have. Where does depression come from? What causes it? It's not really caused by one single factor. There's a number of causes and interlinking causes and factors. There's a biological cause. So really with depression, it can be biological. It can be genetics that can lead to it. It could be no circumstances or anything that happens, nothing that really stands out. But my clinical explanation for this is that maybe the chemicals that swish in the brain and the body aren't swishing in a way where they're interacting and they're working very well, which causes someone to be depressed. Someone can also be depressed, like we had talked about, from physical health care concerns, physical illness, that can impact someone's mood as well too. Then there's psychological reasons that may trigger folks in being depressed. That is those circumstances that go on in life. And some of that might be bereavement, grief or loss, the experience of any kind of physical abuse or trauma. And then there's social factors that might, impact our depression as well too. Poverty, boredom, isolation, relationship problems. So depression can come from a lot of different ways, and there's not one single factor or one single cause of depression. But the very important thing to know about is that depression is not a sign of weakness or a negative personality trait. It's a medical condition, and it's very, very treatable. So again, in relating it to physical health care, depression is a treatable medical condition. And with the right supports, utilization of coping skills and different things, it is treatable. So what does depression look like? What might we see if we are feeling depressed? So how to kind of be aware of what we're doing with ourselves, and what might we see with other people? These aren't the end all be all of things, but I sort of collected a list of some of the things that you might see. So a loss of interest, a loss of pleasure, and things that you used to enjoy doing. Significant loss of pleasure. So maybe if you really liked socializing, going online, talking to friends, bowling, hiking, playing with your animals, sports, baking, cooking, hobbies, any of those things that you used to enjoy doing and now really is, my 12-year-old nephew I love because when it comes to emojis, I watched the Emoji Movie and I saw this new emoji. It was meh. I never had heard of meh before. And meh is kind of just, they're there. Not happy, not sad, just kind of feeling that in between. So if you see someone sort of losing that zest for the things that they used to enjoy, it's not changing interests, changing hobbies, drawing a boundary because you're not so sure you want to socialize with a particular person, not having the time to do things. Those are very different than the loss of interest and the loss in pleasure. Another thing that we see too is, I'm going to skip over because my screen's covered up a little bit, so I apologize. Feelings of worthlessness, guilt, or shame. Feeling that nothing's going right. I'm not worth it. Nothing it goes well for me. What's the point? So really that negative sort of view of things and view of life. And it's true. Some things in life may not be going well. Feelings of hopelessness and worthlessness for people right now, especially hopelessness, are very strong with the pandemic. When you are cut off with some of your independence and connections with other people, feeling hopeless and feeling sort of maybe worthless of the things that you're able to do is actually quite normal and natural for what's going on right now with the pandemic. However, if that lasts and persists and starts impacting negatively areas of life that used to do well or flourish or be within norms for you, that's sort of that red flag that maybe it's crossing into that lane of being concerning. So we talked about that lack of hope. Hope is a huge thing. Without hope, life's pretty tough. Not having the hope doesn't mean everything's going to be 100% better. Hope doesn't mean we have all the answers to things, but hope means we have hope. We have the hope that things will look up or get better, and we cling on to that. And that's very important. And when that hope is gone or diminished, that's a big red flag of when depression may be getting a little bit more on that moderate or severe side. Folks may be increased crying spells. Maybe you know why you're crying. Maybe you're crying out of nowhere. Maybe you're crying at the drop of a hat. So there's that increased sort of emotional vulnerability where you see a lot of crying. A big one right now is that difficulty with concentration, focus, or making decisions. This isn't your basic indecisive person. This isn't necessarily as we get, I don't say older, I like to say more established, that maybe our concentration, our focus doesn't go so well. But when someone's under stress with depression, especially, and they have a depression or a mental health challenge going on, it directly affects the concentration or the focus and the inability to make decisions. So maybe someone's, I don't know what I want to do. I don't even know where I want to eat or if I want to eat, just daily decisions. Difficulty with focus or concentration. Someone's just not there where they usually are. Or even, I find myself with the stress of the pandemic and things going on, it definitely impacts me. And I notice that I will walk into rooms and not even remember what I walked into a room for. So that's some of the examples of what it can look like with focus or concentration. Poor motivation is another one. Poor motivation, there's energy in their motivation. Energy is that, energy we have within our body to do things. We may have a lot of energy to do something, but we may not want to do it or have that motivation. And motivation goes for all of those things that we enjoy life, but it also goes for things like those basic life necessities. Poor motivation to attend to hygiene, brushing our teeth, showering, changing, washing our clothes, maybe keeping up on housework and house chores. Poor motivation to even go out or to gather groceries. Poor motivation to even cook our meals or do those basic things and not feeling motivated to do it. In some situations, you see the motivation impact people where they aren't attending work. They aren't attending the spiritual events or church or those types of things that they would generally attend, or even school. Depression isn't always sadness, blues, and being upset. Depression can also translate into someone looking very angry or irritated, very easily irritated. You might say, you know what? Joe used to be a really easygoing guy, but it looks like all he does is snap at everybody all the time. And boy, he's very angry. That may be a sign of depression. Low self-esteem, low self-confidence, and withdrawal. Withdrawal is a very big one. There is a difference between withdrawing and social distancing. And Elena's actually going to talk about it. There's a point on one of her slides where I heard a really great thing is that, we use the word social distancing right now with the pandemic when we really should be using the word physical distancing, because social distancing applies withdrawing from other people when that's not necessarily what we should do or need to do or have to do. There's physical distancing, but we really don't want to socially distance. So if you see someone or know someone and think, you know what, boy, they used to call me and check in every day, or I talk to them every other day, or I don't remember the last time I've seen cousin so-and-so at an event. We're all withdrawing to a certain amount right now because of physical health reasons. But withdrawing isn't always physically. It can be emotionally withdrawing from people as well too. For folks with developmental disabilities, for individuals with an intellectual or diagnosis, a disability diagnosis, you may actually see, and this could be across the board for people, but especially for folks with disabilities, you may see when they become depressed that they may regress to childlike behaviors. They may start doing things like sucking their thumbs or baby talk, or being extra clingy to people when they haven't been before. Some of the things may even revert to not being able to feed themselves independently like they used to be able to do before, dressing themselves independently. And it also may look like bowel or urinary incontinence as well too. We talked about if depression goes long enough and becomes untreated and goes into that severe end, that it could become life-threatening. And that is really important to know, because someone may have thoughts of death or dying or not wanting to be around anymore if the depressive symptoms get too significant or severe. If that does happen, that's a time for a support or someone that reaches out or knows to be able to outreach, show support, and give that individual contact information and resources, which we'll be able to show you from the training today. So how does depression impact the body, right? So the body and the mind have a big connection. You may be very tired. You may be very lethargic, a decrease in overall energy level. And as the opposite effect too, some people may find themselves, believe it or not, when they're depressed, feeling just the opposite. High level of energy, restless, extremely fidgety, feeling so uncomfortable because their body isn't able to really sit still. It also may affect our sleep, insomnia, not being able to sleep, early morning waking, sleeping too much, sleeping too little. We take our stress to bed with us. People think just because you go to sleep, you're going to sleep away your stress. That's not the case always. A lot of times we take our emotional challenges to bed with us, and we may experience things like very vivid dreams, nightmares, sleepwalking. Maybe if we are someone who punches and hits in our sleep or talks in our sleep, we may do that more. Persistent aches, pains, headaches, cramping, digestive problems, certainly there is a direct connection between mental health and how our guts work. So we may see things like constipation, diarrhea. Believe it or not, and I like to talk really frankly, is that with the emotional uptake of mental health challenges because of the pandemic, one of the complaints that I've heard most from people is that their guts are not the same. Someone might say, I am a person who usually goes to the bathroom once a day. I find myself with stomach aches and in the bathroom all of the time. And that may be directly related to the level of stress and anxiety and depression going on. Appetites, increased or decreased, not wanting to eat, looking at food and going, oh, I don't think I can even eat that. Or an increase in appetite. I know when I'm feeling a bit on the depressed side, I'd like to know where my Better Made potato chips are and my Ben & Jerry's ice cream. So it could be one side or the other. When folks are experiencing depression, they may injure themselves more often or be more accident prone. And the reason for that is twofold. One is that we're putting our body under stress. So when we're under stress, our muscles tighten up, our bodies tighten up, and then we are more at risk for pulling and injuring ourselves. In addition, we may be more accident prone. We may be dropping things, breaking things, bumping into things more often. And one of the reasons is because depression affects our focus and concentration, we may find ourselves more accident prone than we generally are. Weight gain and weight loss, bladder or bowel control difficulties, that can be affected as well. And then those hygiene and self-care changes, looking at ourselves or looking at folks around us, and or if you're a caregiver, is someone looking a little bit more disheveled than they usually are? Are you noticing they haven't changed out of the same clothes? Are you noticing that they're in their home and they're not keeping up on maybe some of that general housekeeping and different things? Those can be all signs of depression. In addition, what I'd like to do is move and talk about isolation. So we've talked about depression. We're going to talk a little bit about isolation. And then Alina's going to move to, well, what do we do about it? What are some of the resources, the things that we can do? So the more kind of enlightening side of it. So when we talk about isolation, isolation is a very high predictor of depression. So isolation really and depression go hand in hand. If someone is depressed, they may isolate more. In addition, if someone isolates or is isolating or is maybe not, whether they choose to isolate or maybe they don't choose to isolate, like with the pandemic going on right now, many of us are almost forced into an isolation that we may never usually put upon ourselves. And the concern with that is that someone that may not be depressed at all, who is put into a position where they are isolating more, can trigger depression. And that depression could be a challenge of depression or even grow to something that is severe. So isolation and depression certainly go hand in hand. And I don't think it's a surprise for many of you that are, Zooming in today and that maybe are a caregiver or a support or someone with a disability yourself, that individuals with disabilities are definitely overall exponentially more vulnerable to isolation. Just thinking about the pandemic right now, the ways that we're isolated and that the things are done so differently. For individuals with disabilities, like developmental disabilities, some of them may not be able to navigate the community independently without a support. And when we're told to stay away or we're told to physically distance and not go to places, that impacts folks. I had mentioned for the community that visually impaired, I was reading a lot about just things that prompt isolation. And I never really gave it much thought. And I thought, wow, it really makes a lot of sense as if you're doing your mapping or if you're familiar with places that you go and all of a sudden things are changed around. I go into Kroger as an individual who doesn't struggle with my vision and want to feel like I want to pull my hair out of my head because of the aisles having arrows and all of the different barriers going on. When as a seeing person, that's extremely difficult and frustrating for me. And I can't imagine some of the barriers and the other things that folks with disabilities or maybe visually impaired have to navigate. If you have any thoughts or want to add on any other things, especially during the pandemic, that have impacted your ability to be independent, please feel free to go ahead and raise your hand in chat, because I'd really like to explore those and be able to mention those because I think they're very important. Someone had asked, I'm going to go over to the questions. Are depression signs and symptoms generally the same for kids? And overall, yes, signs of the things that we had talked about are generally the same for kids. Some of the additional things that you might see for kids that weren't on there is acting out behaviors. They may become more obstinate or not listen or throw tantrums. And those might be some things that you see aside from your just general crying and being depressed. In addition, for individuals with intellectual disabilities with maybe lower IQs, you may also see some of those behavioral acting out as well too, tantrums and things like that when individuals are depressed. There's of course the barriers like we had just talked about with the independence have definitely increased with COVID. Really learning to adapt and do things much more differently than folks have. And it has affected us as a culture without a doubt. I know that I've talked to many groups of, again, I don't say the elderly, I say more established folks, and gone out to some of the assisted living centers and different things, and how high the depression rates are with older individuals because they're not able to be as independent as they have been in the past. And then again, I've listed and I've talked about the fact before of that word social distancing. Sometimes when we say words and we say things, we take on that emotional meaning of it. And what I've started doing just within my own life is say physical distancing versus social distancing. Because for me, when I say it, whether I realize it or not, it really does impact my emotions when I take a step back and looking at it. I don't want to social distance from people. I still want to stay connected, but I do want a physical distance to be able to provide that support and that safety for myself, my family, and other people. So when we move in and we talk about not social distancing, in a few minutes, Elena's going to go ahead and take over and talk about some of the activities and different things that we can do to go ahead and cope and sort of fight back against that isolation and depression that many of us may be experiencing, and even an increased experience because of the pandemic right now. We really tried to think outside of the box and give you some ideas and different things, as well as give you some links and some resources to some ways to be able to keep outside the box as well too. So in a moment, I'm going to go ahead and switch it over to Elena. So you'll be starting to hear her voice, and her voice will be coming over the closed captioning. If there's any kind of activities or things that she's mentioning or any topic that she's talking about, and you want to go ahead and also interject with maybe some things that you do or ideas, again, we welcome this because this is a learning experience for everyone. So with that, I'm going to go ahead and stop talking for a little bit, and I am going to ask Elena to go ahead and join in.
All right, thank you, Adrienne. All right, go ahead.
Okay.
Okay. So physical health check in out. As Adrienne had said, physical health checkup. We need to also consider our physical health along with our mental health. It's super important to continue checking in with your doctor to make sure everything's doing well for yourself, make sure you're eating healthy, no concerns with any other physical health that you have going on. Underlying your existing physical health conditions. Sometimes some of us have existing physical health conditions that we have to consider along with our mental health. Some may have diabetes, high blood pressure, heart disease, things like that, and those also impact our mental health. If we do not have those under control, then that affects our mental health. Dental needs is another large issue that we have to deal with. Individuals with developmental disabilities have a difficult time with their dental needs as they don't like people being in their mouths. That's a sensitive area for them. But dental needs can lead to other problems in your health, mental and physical. If you get an infection in your tooth, it can spread to other parts of your body, and then it can make you more depressed. So you need to make sure you're keeping up in your dental health, dental needs. Keep up and don't skip already existing appointments and routine appointments. This is super important. This is part of your day-to-day living. If you're skipping out on appointments, then you're not keeping up with everyday appointments. Exercise and movements. This is super important. As Adrienne said before, you need to get up and move. Getting up and move helps not only your mental health, but your physical health. It helps with your digestion. If you're having issues with any of that, exercise and movement helps you get up and go. There's a few different websites that we have. We have intimateflowdance.com that will help with different types of dances, different things you can do. And we have disabilityhorizons.com, which is also another website that you can use that gives kind of some barrier-free exercises that be helpful. So that way you don't have to get up and move around as much. It's more like you could do things on the chair or where you're sitting. So it makes it easier for you to continue with your exercise and movement. And we also have a resource here at St. Clair County Community Mental Health. It's a free beginner's yoga, virtual yoga. It's very easy moving, no problems with movement. It really works muscles in your body that you really didn't think you had at one point in time. The yoga really helps your body move from day-to-day living. All right, important for the supports. We have most of our people with a developmental disability, some with visual impair, have supports in their life. Not only them, but I have supports in my life. It's super important to model certain behaviors. If I'm down, depressed, sad, my children, my husband, my parents, they pick up on that. And sometimes when I'm sad, other people get sad because that's what they're around. So we need to consider that when we're dealing with our depression, that if we're sad, if things are going on, some people kind of mimic those behaviors. Check in and connect. This is super important as well, as Adrienne said before. We need to continue checking in with our peers, our family, our loved ones, our friends. We need to continue having those conversations. If it's, through virtual, if it's through a phone call, whatever it may be, we need to continue to check in and make sure, are you doing okay? Is there something you need? How are you feeling? Things like that. Patience. This is one that I struggle with. I know that for sure. Patience. We need to understand that everyone doesn't move at the same pace and everyone deals with things differently. And it may take time for other people to get through different parts of their lives. This pandemic has made a huge difference in people. Some people have been able to be very resilient and been able to do things very quickly and bounce back. Other people, it's taking longer. Sometimes with depression, like Adrienne said, it could turn into a long-term depression. but that's what we don't want to have. So we need to have patience and work with people and understand they need to work on their own time, but we don't want it to lasting too long either. Thinking outside the box. This is super important when dealing with, I'll go over that a little bit more in a minute as well, but thinking outside the box, finding things to do that you usually don't do all the time. I'll go into some activities in a little bit that can kind of, you can do that you used to enjoy, and activities that you used to enjoy and you can do in your house. Encourage independence. This one's big. Independence is something that we all strive for, no matter what. So encouraging someone to go out and go for a walk up to the mailbox, or encourage someone to walk around the house, or encourage them to walk somewhere by themselves safely so they know where they're going and they're showing that they're able to do things for themselves. It may be going to the store by themselves, but you could start off small and go forward. Ask what an individual may need or prefer, encourage their voice. Just because you can talk for someone doesn't mean you should always talk for the individual. People have voices. Let them have their say. It may not be anything that you think is important, but for them, it's very important for them to be heard. We have quite a few different resources that you can use. We have the St. Clair County Help Card, which is located on our St. Clair County Community Mental Health website. It has a lot of different resources in the community that you might be able to access. We have the Blue Water League of the Blind that is also helpful. And then the St. Clair County Community Mental Health website and resource library at sccmh.org. And those have lots of resources for individuals in the community. And then if you need help, ask for help. Don't be afraid to ask others for help. It's not a weakness. Routines. This is a key. I know I got myself stuck during the COVID of not wanting to get up and get dressed, and it really messed up my day. Routine is a key wellness factor. Whatever your routine may be, you need to continue doing your routine to help with depression. If that is get up and brush your teeth or get dressed or eat first, whatever it may be, continue your routine. If you don't get in your routine, then depression starts kicking in more. The hygiene, that's super important as well, part of your routine. Making sure you're brushing your teeth, you're washing your hair or showering daily or every other day, whatever you prefer. Making sure you're putting on clean clothes, things like that. Use reminders on texts and phones. Don't be afraid to use reminders on your phone. Sometimes things get away. We get busy doing things. Sometimes we forget we have things to do in our lives. So it's super important to have reminders on it for us and let us know. Be mindful of any significant life changes. Sometimes things happen in people's lives, and we need to be aware of that. Everyone reacts differently. If someone passes away, sometimes that can make a huge impact on some people. Some people it may not. Maybe they weren't close to that family member or friend that passed away as someone else was. So you need to be mindful of changes in people's lives. Picture schedules. This one is super important, especially for individuals with a developmental or intellectual disability. A dayinourshoes.com is a good website to be used for picture schedules. It's really easy access to find options and how to make picture schedules. Picture schedules just helps people stay on track, pretty much kind of like the phone sort of thing. Picture schedules you can post in the bedroom, like this is what I do first. You can post it in your living room. You can post it wherever you need to in order to help you get through day by day of what needs to be done next. Mix up the standard or boring. Don't do everything standard. Make things fun. Do different things like that. And choice. Don't let technology scare you. This is a big one that we've all kind of gone technology savvy in the last year. Use your technology. It's very helpful. There's a lot of options out there for you. Stay informed, yet be mindful of boundaries. When you get on technology, the scary part is sometimes you can go on that rabbit hole and find a whole bunch of information, and you can just keep getting yourself deeper and deeper and deeper. You need to be very careful when you're doing that. Make sure you're staying informed, yet mindful of boundaries. Don't be exploring all the different avenues of everything, because you're going to come up with answers that may not even be correct. but you also need to know that technology can be helpful. There's support groups online. You can find all different types of support groups online for people that are dealing with all different situations, and they're there to help you. Classes, there's multiple classes now that are offered online. St. Clair County Community Mental Health has classes online. You can find that at sccmh.org. And the MSU Extension also has different classes that are offered that will be helpful. TED Talks and podcasts is another resource that can be used to be helpful on your technology. TED Talks, they go about any sort of thing you want to kind of look about. They talk about the depression. They can talk about how to make yourself happy, how to find skills, how to do anything like that. There's documentaries or tours that are available online. Goodhousekeeping.com is a really good website for that. You can go see museums, zoos, different things like that that you may enjoy in the past, and it's a little bit more difficult to do that now. So that's one thing that make sure you check out. And then invest in your digital, so you may not otherwise invest in, such as there's so many different options out there nowadays, such as YouTube, Netflix, Disney Plus. Now there's the new Paramount Plus. There's all different types of digital that you can now do monthly, and they're not usually that high of a cost. And then the role of silence. All right, try a new activity. So these are some activities that you may have enjoyed at one point in time in your life, and things that you can now do and modify them to enjoy in your house, such as scavenger hunts. This one you can do inside, outside, wherever you prefer. You can set up your own scavenger hunts throughout the house and put different objects throughout the house for people to find. Or you can do a scavenger hunt, say outside, and tell them to find a flower, to find a rock that's shaped like this, or find a piece of grass, or do something along that. A dance party. This is also could be something fun. You can put a dance party on. You can make it a themed dance party. You can say, let's do an 80s theme. Let's put on some 80s music, dance away, maybe dress up as 80s, things like that you can enjoy in your house. Learn a new language. This is also something that could be fun and interesting, that you can learn a new language. You can talk to other people and learn something new. Journaling. This is another one that you can do at your house, just a piece of paper and just journal what you'd like. Pen Pals with a Purpose. This is a new activity that we are offering here at St. Clair County Community Mental Health. And I'm going to pass this over to Adrienne so she can tell you a little bit more of this great opportunity.
Okay, thanks, Elena. So yeah, like Elena said, really thinking outside of the box, trying new activities, modifying things that you're doing. I'm going to talk about the Pen Pals with a Purpose, but I also wanted to say I am blown away and amazed by all of the different apps and things that are online right now for people, even for individuals that are, visually impaired. Being able to learn new languages. There's apps on phones. There are things technology based where if that's something you've always wanted to do, you can do things like that. Journaling prompts. A lot of people like to journal or write things down, but sometimes people don't know even where to start. And there's a lot of really good places that say, all right, write about a great memory from your childhood. What's a place you'd like to go? So that just kind of gives that prompting for other people. And you know what? If you live in a house with someone else, I have actually heard of people getting notebooks or typing notes or taping some kind, like on your phone, like taping your voice and sort of doing like journaling back and forth and asking each other questions. Hey, what was the best part of your day, and things like that. So creative ways to be able to talk to friends or family, whether they're in the house or not. Pen Pals with a Purpose is really exciting. I wanted to share with this group. It's something that is new. And what it is it's a program that was developed via St. Clair County Community Mental Health. And with depression and isolation and so many other factors going up because of the pandemic, we really looked at how we can start connecting folks. And one of the ways we decided to do that is start a Pen Pal program. So it's an actual structured Pen Pal program where if an adult is interested, they can go on our website, or you can contact me and I can give you the information, and you can sign up to be a Pen Pal to a youth. So we have youth sign up and we have adults. And then what we do is we take those and we match them together. The Pen Pal program, if you are interested as an adult, you have to fill out like a attestation or agreement. You also have to agree to get a background check that's free of charge, and we complete the necessary means for that. So you don't have to necessarily do anything or go anywhere to get the background check, but we do ask that that's done, and that's mandatory. Then once you go over that, we give you a packet, and we can certainly provide that packet accessible in different ways to folks. If it's something that you need accessibility wise for a visual impairment or something else, we can think very creatively and get the information to you. And what it is it is kind of a standard. I believe we asked you to at least correspond with your pen pal 6 times. And we actually have different prompts. We talked about those journaling prompts. What is something that you're grateful for? What is something that you want to share? And what happens is that you write to your pen pal, you send it to St. Clair County Community Mental Health, and we route it because your pen pals are actually anonymous. So it's growing. We've started our pen pals connection. We've actually started folks getting letters back and forth, and it's fantastic. And the purpose of it is to, again, help out with that depression and isolation, but kids love getting mail, right? It's exciting. Who doesn't, right? Who doesn't? We don't get cards and envelopes and mail and postcards like we used to. And the kids that are in our program are just finding that it is just exciting. They cannot wait to get their next letter from their pen pal. And we're really seeing an increase with the adults and just the enjoyment they're getting from it. So if you're interested in the Pen Pals with a Purpose program, please look on our website. There's information. I'm sure Jill will post that on there, or you can feel free to contact me or even just call our main line or Elena and just say, hey, I want to know more about that Pen Pal program, because that might be something really cool to do during, this time of year and the pandemic going on. So I wanted to spend more time talking about it because it's new and it's super exciting. So, all right, go ahead, Elena. Thank you.
All right. Thank you, Adrian. All right. So we talked about the pen pals. Interviewing others. This is another one that is not really done that often, and you can find a lot of information about people when you interview them. I know I one time watched an interview that my nephew had done with my mom, so his grandmother, and just the questions he had asked her, it was one things I would have never thought to ask my own mother, even though she'd been my mom my whole life, obviously. So interviewing others is something that's really important, especially maybe even those generational gaps. Having, grandkids or, your neighbor that might be a, different generation. Door drop. This is another thing that people enjoy. Dropping off something to a doorstep for someone. It could be someone or maybe even someone you don't know. I know for a while there was some things on social media that people were doing door drops. There's different groups that were doing different options, but just be careful on that as well. But that's another thing that people enjoy. Yoga or exercise, we kind of had talked about that before. And then what are other things you've kind of enjoyed in the past that maybe you want to try again, such as maybe you used to color, or you used to knit, or you've done different opportunities like that. Maybe that's something that we need to go back and try again, and maybe we have a little bit more time and that'll you can enjoy that again. Modifying activities. These are things that maybe you had enjoyed in the past, and then you haven't been able to do so much, such as balloon volleyball. I know I probably couldn't play volleyball now today like I used to when I was a teen, but now I can play balloon volleyball in my living room. I blow up a balloon and we hit it back and forth and don't let the ball hit the ground. And we actually do this quite often in our house. Hallway bowling. This is another one that could be fun, that since the bowling alleys were closed for the longest time, they're now starting to open back up. But hallway bowling, you can use 2-liter bottles of pop or cans that are empty, and then take a rolled up sock or a tin foil ball or something like that and set up the pins at the end of the hall and then knock them down. Camping or movie nights. You can enjoy a movie at your own house. You can set up, you can get popcorn, you can, set the mood and just kind of relax and enjoy a movie. And then you could always get up and pause it if you have to use the bathroom. Postcards, pictures, mail. That's kind of goes along with that pen pal, that people enjoy getting mail. Most of the time, the mail that I get is ads and bills. So it is nice every once in a while when I do get something that's not one of those two things. Virtual trivia or talent show. There's a lot more of these options out there right now. You can enjoy virtual trivia or a talent show online. Virtual meetings or gatherings such as this. You can use Zoom to get together with family members. I know for Christmas, that's what we ended up doing for my Christmas was we ended up having like 20 different people in on a Zoom meeting to enjoy each other because we weren't able to get together with a large family. Ask to be FaceTimed or Skype to be included. Don't feel like you have to be excluded from everything. If you want to be involved, then get yourself involved. And then most of the things you can still do. You just have to find ways to modify it and ways to enjoy it. You can do it in your own home or go outside in your yard and just try to find things that you can still enjoy and change it. Things to do to bring pleasant emotion. Some things we got to think about is beyond finding things to do, you need to find things that make you happy. Some things maybe watch or listen to TV or songs that you enjoy. I know there are times where it's nice to go back and watch those old Disney movies that I used to watch when I was a little kid. Those kind of bring me some happiness knowing that once I was a little kid and I had a great time. Blast to the past, same sort of thing, things that you used to enjoy and things you enjoyed when you were younger. Comedies, laughing helps depression big time. Even if it's just a short time, there's lots of different comedians out there. Make a list to accomplish. This list doesn't have to be a long list. It could be the smallest list. Like today I need to clean my bathroom. Today I want to organize my closet. That kind of goes along with the next thing. Clean and organize and donate. Sometimes I have that one corner of my closet that I need to go through, clean out, because that's what gets piled on, and then I can donate to a local organization. Spring planting, that's coming up on us pretty quickly. Spring planting, you can get down, clean the garden out, get it all ready, and then by summertime, your garden would look beautiful. Utilize your 5 senses. This one you can use in different ways. You can make your own type of Play-Doh. You could make cookies. Cookies is a big one that you could use quite a few different senses on. You could make the dough, and then obviously when they're baking, the senses of smell, and then at the very end, you get to eat it. Positive self-talk. If you talk about how, talking positive about yourself, then you'll start feeling better. If you're always down on yourself, you're going to continue to feel down. So you need to thinking positive. Exercise. We've talked about this quite a few times. We need to continue to exercise. That helps our endorphins get going and helps us get going. And being outside, now that the weather's starting to be a little nicer on some days, get outside. The fresh air is good for you. It makes you just kind of relax, and sometimes it does help you sleep better, even if you do have some of that depression or stress going on in your life. Keeping connections. Make sure you check in with others. Not only the people that you usually check in, but maybe that one cousin or that one friend that you kind of are concerned with. Maybe this is the time to really check in and say, hey, how are you? It's been a while. How is everything going? Ask others to check in with you. Maybe you're struggling and you think, okay, you know what? I'm having a hard time. Maybe I should call my one friend or call my aunt or call my mom or call whomever it may be and say, hey, can you call me later? I just want to check to see how everything's going. Verbalize your needs, wants, and preferences. You have a voice. Make sure you verbalize what you need and want and prefer. Even if it's just the smallest thing like, hey, I need a break. I need to get away. I would like to eat pizza for dinner, whatever it may be. Sometimes those are things you need. Hear a voice, see a face. Sometimes it's hard to hear voices and not see who you're talking to. That's why it's super important to sometimes use the technology so you can do things like this, like Zoom and FaceTime. Community faith-based supports. There's lots of different opportunities for community and faith-based supports out there. There's lots of different churches. There's lots of different organizations. They're starting to gather a little bit more with the distancing with each other, but they're starting to meet a lot more, and they're also offering opportunities online. We also have a CMH COVID support line that if you're really struggling with the whole COVID, you're worried about anything like that, dealing with depression, anything like that, and it's at COVID-19 support at sccmh.org, or there's a call number of 810-985-8900. You can ask for the COVID support line, or you may text 810-956-6335.
All right, so I want to add that COVID support line is really open to anyone in the community. I can tell a personal story. Just a couple of months ago, one of my mother's really close friends came across that number, and she had called an outreach and told my mom, I just needed to talk to someone. I was overwhelmed. I was lonely. I just needed to hear another voice, and it was someone to be able to talk to. And boy, did it help at that moment. So it's a real good line to be able to have and to maybe share with others as well too. So thanks, Elena, for talking about, some of the things that we can do. It's all about modifying. What kind of things do you enjoy or have you done? I know the other day I sat on my phone, and I'm not going to reveal how old I am. Okay, well, I'm 43, so I think I'm still a baby, or I hope I'm still a baby. But I got on my phone and just went through old songs that I have not heard since I was in middle school, just for the heck of it and the fun. And it really prompted those positive emotions, because we all know when we're already feeling a little bit lag or blue, the last thing that you want to do is watch Old Yeller or listen to some music that will, keep you in that emotion. It's called opposite to emotion and trying to flip it. And it doesn't mean you're going to be happy and ecstatic. It just means sort of getting out of that funk by doing things to increase that. The other thing I wanted to point out is Elena had talked about when she talked about technology and having boundaries. And that is something so important that we talk about with the pandemic, is that it is important to be well informed, yet watch how much intake of information you're getting. Sitting in front of the TV constantly with that barrage of just numbers and impact and death and fear, that whittles away at people after a while. So it's important to be informed, but also know your boundaries of when being informed is enough and to be able to move forward and not so stuck to it, because that could certainly be something that increases our depression and increases our anxiety exponentially. When we mentioned some of those classes through CMH too, we have virtual cooking classes, and you can certainly listen. It doesn't have to be anything you have to follow along for. We have classes on building your own personal mission statements, which are really great and really empowering. So a lot of really cool opportunities out there as well too. So winding down, I'm not going to go over all of these in depth, but I wanted to talk about a couple of basic skills that folks can use besides the things that we talked about when you're finding yourself really struggling. And the first one is deep breathing, or breathing in general. Breathing is one of those beautiful things that we have with us no matter where we are. We always have our breath with us, but do we always breathe well and breathe appropriately? And when we are having times of having mental health or emotional struggles, feeling anxious, feeling depressed, feeling a bit off, our breathing is so important to regulate the rest of our body. So there's different ways that we can breathe by taking deep breaths in through our nose and out through our mouth. When we get excited, panicky, upset, we tend to breathe quickly and in and out through our nose. And if you try that for a second, trying to let you guys, it's so hard when we're not in person, but you don't get a full and complete breath. It's sort of like Lamaze breathing, for labor. You do that in through your nose and out through your mouth and taking a complete breath. It helps slowing down the body functions. It helps slow down our mind a little bit for when our mind is stuck or racing. So when you have a moment where you're feeling tense, take a breath and notice your surroundings. And we're going to talk about how you can notice those surroundings and utilize your 5 senses to get you even deeper into sort of a relaxation and more of a calm and Zen type of place. The other thing is when people get really upset, we forget how to breathe. We are all over the place. And if you're feeling upset and your breath is off, or you notice somebody else who is might be a child, adult, whoever it is, remind them to blow bubbles. So when we were blowing bubbles when we were kids, remember when you blow through that wand, the cadence and the rate that you use when you blow a bubble. So just thinking about it now, we do a slow breath when we do bubbles. That's a good way to remember when we are maybe stressed or breathing heavier and need to take a deep breath, the rate at being able to take that breath. It's a healthy, refreshing, mind resetting rate. If you are a caregiver of someone, not only practice this yourself, but practice it along with someone. Let's practice breathing for a second. Let's pretend we're blowing bubbles. Let's go ahead and do it together. Encourage others, because healthy habits like that are contagious, but a good contagious. Imagery is another way to be able to change and have the power of change in how you feel. And it doesn't always have to be visually. Imagery can be done through our senses. And through our 5 senses, we have, don't forget, our sense of taste, our touch, our smell. And as we are trying to be in the moment, and we're doing something, and we want to take those deep breaths, take in your surrounding. When I go for walks with my 8-year-old, I'll say, let's hear what we hear. And that for him means we're walking and we might be silent, but we want to hear what's going around us. The squirrels may be running, the crunching of the asphalt under our feet, the birds. When you really take a moment and you really listen to your surroundings, it helps kind of calm the mind and center us and bring us back. We can use that with a sense of touch too. If you put your hands just on the table right in front of you, take a moment. What does it feel like? Is it smooth? Is it rough? Is it cold? Is it warm? How do your hands feel connecting to the table? So taking those moments to use your senses and what that connectivity feels like. Other things with the sense of taste. I don't know about you, but I take a sip of coffee or eat a piece of popcorn. I don't know the last time I ate one popcorn and one M&M. Do we really taste our food? So maybe challenging yourself and spending some time going, you know what, I'm going to taste my food. Spend 30 seconds trying to chew an M&M. It's an experience that is just very out of the box and interesting. But what does it feel like on your tongue? What does it taste like? What does it sound like when you're chewing? Have you ever just had one piece of popcorn? What's that like? If you're drinking something and you're feeling tense, take a big drink and imagine and feel what the water feels like going down your throat and hitting your tongue and what the taste of it is. Using imagery is very powerful. Not only is it a powerful thing to use your breath and imagery when you're stressed or struggling, but it's very important to do it when you're doing well as well too. As humans, we generally wait till we're stressed or having times of distress to start using coping techniques and strategies. As humans, it's very important to use coping techniques and strategies at times when we're doing well. Self-care and preservation, it helps prevent. So just like we may take vitamins, hydrate ourselves, get good sleep, go to the doctors, get mammograms, things like that for preventative for physical health, you can be preventative for your mental health as well too. And not only do it for yourself, but encourage the folks around you. Scents are a big one, your sense of smell. For individuals with disabilities, especially folks that maybe live in group home situations or things like that, one of the things that we hear a lot because of the pandemic, and this may be just for general folks too, is we are getting so used to smelling disinfectant smells, Lysols, really harsh smells because we're around so much cleaning items all the time. And including folks with disabilities when they're living in maybe an assisted or someone that's living in an assisted living center, things like that. Our sense of smell may be overrun right now by cleaning supplies and things like that. So incorporating those sense of smells, the lavenders, the calming smells, the things that we can do just to incorporate our sense of smell. It's getting nicer outside. Maybe being able to open the door, open the windows, having the smell of nature come in as well too. So don't negate or underestimate our sense of smell and the importance that it has. There is a direct effect with our sense of smell to our thoughts and our memories. Isn't it amazing how when you smell something, it triggers a memory in your head? I smell, a certain flower and it makes me think about my grandmother all the time. So we have this direct connection between our nose and our brain. So if we're able to introduce those pleasant smells and those relaxing smells, it could be a very small thing that really helps our mental health in a positive way. Mindfulness talks a lot about what we had talked about. It gives you that, being mindful, eating mindful, smelling mindfully, not just being really in that moment and paying attention to what's going on with all of your senses. Another really good thing to do is progressive muscle relaxation if you find yourself very tense or upset. And what progressive muscle relaxation, sorry, I had to take a drink of my water, essentially is as humans right now, if I asked you if you're relaxed, you might say yes. But if I said, pay attention to your body right now, are your arms tense? Are your toes curled up? I bet you every single one of us could relax even more from the position that we're sitting in right now. Like right now, I know I can drop my shoulders. I noticed when I just said that my feet are in a really awkward position and not relaxing. So taking notice of our body and if there's ways that we can relax it more. Progressive relaxation, if you were to Google it or look it up, basically what that is kind of a forced relaxation of the body, where you start purposely crunching up your whole entire body and then you relax it. And then you crunch your eyes and then you relax your eyes. And then you crunch up your nose and your mouth and then you gently relax that. And then you crunch your shoulders and you work down to your abdomen and then to your legs, all the way down to your toes. So you're almost doing a whole body scan of purposefully making it a bit uncomfortable and crunching it up and then relaxing it. And it's amazing sort of the relief that you get when you do. And then you actually become a little bit more mindful of your body and the state of relaxation that it can be in. As far as breathing and mindfulness and senses, there are so many unbelievable resources out there to expand on all of this. Mindfulness, breathing, imagery, all important components when it comes down to depression and imagery. In individuals that maybe have a disability or maybe have some accessibility needs, there are so many things out there and so many ways that you can access things. Like I said, with the 5 senses, if visual isn't something that can be done, there are the other 4 senses that you can really embrace, which I'm sure many of you do, but really taking a moment, like I said, when's the last time you chewed one piece of popcorn or one M&M and saw what that really tasted like? So again, thinking outside of the box between activities and different things, there are some activities that you can do for your mind that may be able to help with depression and isolation. The very last thing that I wanted to talk about was it is okay not to be okay. We've talked about what isolation and depression is. We've talked about skills and strategies and what to do. And some folks, no matter what skills and strategies they use, they may not feel better. They may feel worse. It's okay not to be okay. It's okay not to be okay on a daily basis. And especially with the pandemic, or despite not having the pandemic around, it's okay not to be okay. And being able to say you're not feeling okay, reaching out to support, reaching out to get help is okay. And there are many of different ways that you may need to do that. Medication may be something that may be short-term and needed, a light antidepressant or a medication or an anti-anxiety medication. Again, for those individuals who maybe have a hard time verbally communicating and that are having problems with depression or anxiety, it may be the time to talk to a doctor or a professional about it, or even for ourselves. Physical health doctors are really well-versed, more so than they ever have been in mental health, in saying, not just saying I have a stomach ache or I have a headache. I'm feeling really sad. I haven't been able to stop crying. Sometimes I wonder what life would be like without me around. Light boxes. We've all heard of that seasonal affective disorder and not getting enough vitamin D. Things like light boxes and different things can be ordered if you struggle with depression, if it has something to do with the seasons. There's counseling, resources, other support. We have our COVID support line. We have our access to services line through St. Clair County Community Mental Health. If you're interested in talking to someone, maybe getting services or supports, no matter if you're an adult, a child, someone who has an intellectual disability, you can call that access line and someone, a clinician on the other end, will be very helpful and try and walk you through and guide things. We also have our mobile crisis unit, which I want to really talk about and expand on. This is a newer feature that we've had at St. Clair County Community Mental Health over the past 2 years. What it is it's a unit that works directly out of St. Clair County CMH, and it is a mobile crisis unit. It is a 24/7 unit of staff. We have clinicians, nurses, peer supports that man a phone line 24/7. It is available to anybody in St. Clair County, as long as your feet are in St. Clair County. It doesn't matter if you're an adult, a kid, if you have mental services, health services, if you've never had mental health services before, whatever it is. If you find yourself or a loved one or someone that you care for or someone that you're around in a moment where they're in crisis and you're not sure what to do, someone on that other line will answer and walk you through it. We have had schools, family members, places of business call when someone's struggling, and we have someone from the mobile crisis line on that other end to help. Many times the mobile crisis line, if offered or if someone says it's okay, will physically come out and see that person to be able to give that support. So the mobile crisis line is very, very important. Spread the news, let everybody know. It's a number that can be accessed at any time, and it's a great asset. We use it a ton and it's seeing a lot more use. And again, it's available to anybody to use. Another thing is we have a pandemic response team. What this is out because of the pandemic, we have a team of social workers, we have some first responders, we have some pastors, and if any organization, club, school, place of business wants us to come out, and usually it takes about an hour and a half. We will come out and say, pandemic has been a traumatic time. Here are some of the signs and symptoms that you may be seeing. Here are some coping skills that you can use. Here are some resources, and really being able to get people to talk about how they've been impacted by the pandemic. We've done a lot of schools recently because teachers just want to be able to talk about the stress and how they feel. We actually did some interventions with the health department because those call lines and the health department, their heads are spinning with trying to manage all this. We've talked to assisted living centers where folks are just really frustrated and upset because they can't see their loved ones and they can't be as independent as they used to be. A pandemic response team, the First St. Clair County, is a free service that is available to anybody in St. Clair County. And our number for the, if you're interested, all you have to do is call our main line at 810-985-8900. And you can either ask about the pandemic response team or you can ask for Amy Smith, and she is our lead who organizes that. Elena talked about the CMH COVID support line. And I always want to mention the support and as a group for the Blue Water League of the Blind, and how fantastic again, and how much I appreciate Bob reaching out and saying, hey, can you come talk to our group? And not only saying, can you talk to our group, but we'd really like this to expand it to anybody who wants to hear and wants to listen and be a part of this. And for those of you that were here today and able to listen and take part in this, thank you so much for spending the time doing it. And also to let you know, this is going to be recorded and available through our YouTube channel, which Jill will give you more information on in the chat. So if you found this useful or want to share it with anybody, someone can view it after the fact as well too. And lastly, for those of you who are interested in the PowerPoint or information, or want the PowerPoint provided to you, we can do that in a lot of different accessible, friendly or accessible ways. Today's PowerPoint will be available on our CMH website under the events page, under the Disability and Disconnect page where it talked about the webinar today. So with that being said, I am going to go ahead and just double check to see if we have any questions or anything else. I don't believe we do. I'm just going to open it up. If anybody has any comments or questions, we just have a couple of minutes left. Feel free to chat it, or if you wanted to raise your hand, that would be fine too. Jill will be looking out for that. And we'll give everybody a couple of minutes.
We have one individual who raised their hand, so I'm going to allow them to talk right now.
Great, and I think that's Bob, as a matter of fact. So fantastic. If you want to go ahead and unmute, Bob, whenever you're ready.
Yes, I just wanted to thank you for all of you for coming on and doing this presentation for us. And you were also going to send me the information regarding the PowerPoint and some of your links to some of your resources. Is that correct?
It is.
So that I can pass this on to other content in the future?
Absolutely, Bob. What I will do is most likely tomorrow or Monday, I will not only have that information on our website, but I will forward you the PowerPoint and a lot of the resources we talked about. Elena had mentioned the St. Clair County Help Card, so we'll make sure that we provide you a copy of that, and our mobile crisis unit linking information. And I'll have a lot of really good stuff for you so that you can feel free to be able to pass that on in whatever way is most effective for you. But absolutely, yes.
Thank you.
Thank you. And thanks so much, Bob. I was hoping you would jump on and say something. So again, I can't express enough thanks for you coordinating and helping out with this, because it's appreciated. It was really enjoyable. So thank you.
Thank you.
All right. Any other questions or raise of hands? I think we're good. At the end of this, if I did it right, because my technology skills are not the best, at the very end, whether you are on a mobile device or computer, hopefully if all works well, a SurveyMonkey may pop up. If it's something that you are able to do accessibility wise, go ahead. If not, that would be another thing that I will pass on to Bob and really what we're just looking at is feedback and how everything went, what went well. And if you have any suggestions, if we were to do something like this in the future, anything that we can improve upon or add on to, we do like to hear feedback. So with that, I want to be able to thank Elena for hosting with me and the information that she provided. Jill, who is behind the scenes, making sure that all of this technology worked. Thank you so much for your time tonight. And again, thank you everybody for joining. Have a wonderful night. Thank you.